Let's now talk about health. The Social Health Insurance Act of 2023 that repeals the National Health Insurance Fund is now fully in force following its gazettement by the Cabinet Secretary for Health, Susan Nakhumicha. The government's strategy to reform the country's health financing that has attracted sharp criticism from different stakeholders will now force every eligible Kenyan to show proof of compliance and registration failure, to which they will be denied government services. Gloria Milimu reports.
The Gazette notice dated November 21st, 2023 now forces every eligible Kenyan to register under the Social Health Insurance Fund as a precondition to dealing with or accessing public services. Even though the Act falls short in specifying how Kenyans can treat the new regime, sources at the Ministry of Health say the Act that now comes in effect will not be implemented immediately, as deliberations on a transition framework are currently underway. They say the proposed deductions, targeting at least 2.75% of the gross salary of employed Kenyans and a minimum deduction of 300 shillings for low-income earners, will also not take effect immediately. Also, as talks to come up with regulations that will break down or give guidelines on specific regulations of the Act continues, Kenyans will continue accessing healthcare services using their National Health Insurance Fund cards. According to the source, the contentious Act that has been faulted by different stakeholders will be fine-tuned by January 2024. Stakeholders in the health sector have criticized the move, warning that the Act seeks to privatize public health sector and is skewed towards the rich.
If this thing goes how it is, the out-of-pocket expenditure for Kenyans, which is at 150 billion, will actually double. Because it means every Kenyan, whether you're a civil servant or whatever, you will definitely have to spend more in care. Because this particular Social Health Insurance Act will probably cover for you only bed in an hospital. If you visit and if you go to some public hospitals which are not functional, you'll be forced to go to some other private facilities.
Similarly, they warn that failure to review contentious regulations in the Act will infringe on the right to health and waters down the tenets of universal health coverage.
The Act is creating business for private insurance companies, and that is the competition that this Act was installing. That's one concern that we have, and we know that when it was National Hospital Insurance Fund, the money that was given to that institute, to NHIF by government, was I will say what will be given to private is 3 times that amount. So that is one concern that we had, and we have seen by these there's going to be a big outcry, because about 6 million public servants, that is both those in parastatals, the civil servants, the counties, will then have to look for mechanisms to get money in case they go to hospitals and in case they go abroad for Medicare.
In line with the requirements of the Act, President Ruto, through a Gazette notice dated 22nd November 2023, appointed Dr. Timothy Olweny, currently serving as the Secretary General of Private Hospitals Association, as chair of the Social Health Authority that phases out NHIF. On the other hand, the Cabinet Secretary for Health has appointed the Secretary General of Central Organization of Trade Unions, Francis Atwole, alongside Dr. Zakayo Kariuki and Jacinta Kathamu Mutegi as members of the authority. According to the Social Health Authority Act of 2023, the authority shall register the beneficiaries in accordance with the Act. It will manage the funds established under the Act. It will receive all contributions and other payments required by the Act. It will also impanel and contract healthcare providers and health facilities upon inspection, licensing, and certification of the healthcare providers and healthcare facilities by the relevant body. It will also enter into association with such other bodies or organizations within or outside Kenya as it may consider desirable or appropriate, and in furtherance of purpose for which the fund is established, among other roles. For now, it remains to be seen whether the fine-tuned document will consider concerns raised in a bid to ensure smooth transition. Gloria Milimu, KTN News.
Well, that's all we had for you here on KTN Prime. Thank you so much for your company. As always, we don't take it for granted. I'm Ashley Mazuri. Our sign language interpreter is Damian Evans. Up next is Scoreboard. Have a good night and enjoy the rest of your viewing.